So friends, this is the second part on the topic anti-hypertensive drugs. And this here is our basic formula which we brushed up in the first part. That is blood pressure is equal to cardiac output into the peripheral resistance. And we also saw this point made in the first part. That is, the blood pressure is regulated by sympathetic system, where the beta receptors would increase the cardiac output and alpha receptors would increase the peripheral resistance. And the blood pressure is also regulated by the RAS system. Okay, now we look at the other drugs which we can use in the treatment of antihypertensive drugs. So the fourth drug is, we have beta blockers, which would obviously block this beta receptors here. So by blocking the beta receptors, the cardiac output would decrease and blood pressure would also decrease. So the drugs which come under beta blockers include metoprolol, propranolol, and carvedilol. So this is carvedilol, this is carvedilol. So now we'll look at the mechanism of action of the beta blockers. So here we can see the beta blockers act in two ways. First one, it decreases the beta 1 adenoreceptors in the heart, thereby decreasing the cardiac output. And as per our formula here, we can see when the cardiac output decreases, the blood pressure also decreases. And the second way is, it decreases the renin. That way, the renin-angiotensin system is also decreased. So decreased angiotensin, decreased peripheral resistance. And when the aldosterone in the RAS system is decreased, so we know aldosterone helps in retention of sodium and water. So when the aldosterone is blocked, we can see that the retention of sodium and water is decreased and circulating blood volume is decreased. That way, there is decrease in BP. So these are the two main actions through which the beta blockers decreases the blood pressure. So the fifth drug we see here are alpha blockers. The examples include prazosin and doxazosine. They are selective alpha-1 blockers. They dilate the blood vessels. By dilating the blood vessels, they decrease the peripheral resistance, and decreased peripheral resistance leads to decreased blood pressure. And a special mention for carvedilol, because it has both alpha and beta blocking ability, but predominantly it acts as a beta blocker. So that was a special mention for carvedilol. The sixth drug we have here is a potassium channel openers, which include hydralazine, diazoxide, and minoxidil. Minoxidil is also used in the treatment for alopecia as a topical treatment. And other than that, the mechanism of action for the potassium channel openers are, they activate the potassium channel, so there is influx of potassium which causes hyperpolarization. They also block the calcium channels that would help in dilation of arterioles. So potassium channels are generally arteriolar dilators. So they dilate the arterioles. That way they decrease the peripheral resistance and decrease the blood pressure. And now the seventh drug we have are nitric oxide releasers. The main player here is sodium nitroprusside. It increases the nitric oxide, and as we all know, the nitric oxide is a potent vasodilator. They dilate both arteriole and vein dilator. And the eighth drug here we have are renin inhibitors. So they act in the RAS system by inhibiting the renin. The drugs include aliskiren, remiskiren, and enalkiren. So you can see here RAN for renin and I for inhibitor. So all these things are renin inhibitors. That is why they're named as such, renin inhibitors. So alpha 2 agonists, the ninth group, include clonidine, methyl-dopa, which are exclusively used in pregnancy because they are safe drugs. The mechanism of action for alpha 2 agonists include, they inhibit the norepinephrine, and that way they decrease the sympathetic system, and that would lead to decreased blood pressure. So here we discussed this picture briefly in the first part. So here I've just mentioned aliskiren, which was a renin blocker, which acts in this step where there is inhibition of renin. And as we all know, the other action for beta blocker is also that they decrease the release of renin. So both these drugs kind of acts in this pathway. So next up, we will look at the drugs which are used in hypertensive emergencies. So we have two routes. First one is the parenteral route. We can give intravenous sodium nitroprusside, which is a nitric oxide releaser. We have IV labetalol, which is a beta blocker, and we also have diazoxide, which can also be given parenterally, that is intravenous. The second route is sublingual. Drugs like clonidine, nifedipine, and captopril can also be used as sublingual route. They are used in case of hypertensive emergencies. So now we've seen all the antihypertensive drugs. Now we can look at the drugs which can induce hypertension. So some indications where we use hypertensive drugs include in case of acute hypotension, where the patient is suffering from a collapse or a hypovolemic shock. So in this particular patients, we need to increase their blood pressure so that the perfusion stays normal. So the first drug we can use are alpha adenomimetics, which include norepinephrine and phenylephrine. And the second drugs are alpha plus beta mimetics, which include adrenaline and ephedrine. So all these drugs would increase the blood pressure and help in perfusion of the important organs. The other drugs which can also use to induce hypertension include dobutamine and dopamine. So that is all for antihypertensive drugs, and these are the drugs used in hypertensive emergencies, and these are the drugs which are used in case of acute hypertension.